Hello everyone, in this video we will discuss about gouty arthritis. After watching this video you will be able to do the previous question and the marrow QMAC module of the same topic. So let's start with gout. There are two topics, gout and pseudo gout. Let's start with gout. It is acute inflammatory monoarthritis caused by precipitation of the monosodium urate crystal in joints. This is asked many times. Monosodium urate, male more than female, and strongest risk factor is hyperuricemia. Patient will present with asymmetric joint distribution, joint swollen, red, painful. In case of rheumatoid arthritis, there was symmetrical joint involvement in previous video. Classic manifestation is painful MTB joint of big toe. Also, it is the most commonly affected joint in gout. There will be tophus formation, and acute attack tends to occur after large meal with foods rich in purine or trauma, surgery, dehydration, diuresis or alcohol consumption. So, if a patient comes with painful swelling in the big toe, what you should do? Investigation choice is joint aspiration. You have to exclude if there is any septic arthritis feature or not. So, as gout is an inflammatory arthritis, the WBC count will be more than 2K per ml, and the fluid will be turbid chalky white. And in this table you don't have to remember the whole table, just see the WBC counts. Normal is less than 200, non-inflammatory is less than 2000, and inflammatory there will be 2000 to 75,000. And in case pleural or septic arthritis, it will be more than 1 lakh per ml. Here it is written that in case of gout, the WBC count may goes up to 1 lakh, but not more than 1 lakh. It will be always less than 1 lakh. And if we do the X-ray, we can see the Martel sign or J sign or Radbitan sign. It is also asked. It is nothing but the punch of lesion and overhanging margin of the new bone, along with edge of the erosion seen in chronic tophaceous gout. And USG we will see double contour sign, it is also asked. And in case of treatment, in acute case we use NSAIDs, glucocorticoid, colchicine. In case of chronic we use xanthine oxidase inhibitors, allopurinol, febuxostat. It is also asked. It is only used in gout. Saturn in gout is associated with poisoning. This is one liner you should remember. Drug precipitating gout, the mnemonic is canned leaf. C stands for cyclosporine or cancer drug, A stands for aspirin, niacin, thiazide, lasix, which is furosemide, ethambutol, alcohol, pyrazinamide. And as we read, aspirin can precipitate gout, but high dose salicylate do not precipitate gout. It is also asked. And thiazide, lasix, this antihypertensive precipitate gout, but the management of hypertension in patient with gout is losartan. It also remember. These are very commonly asked. So this is also very commonly asked. Mainly the difference between monosodium urate and calcium pyrophosphate. It is needle shaped and it is rhomboid shaped. And under polarized light, the monosodium urate will be negatively birefringent under polarized light, yellow under parallel, double L and double L, and blue under perpendicular. That's the opposite part. It is seen in gouty arthritis. And in case of calcium pyrophosphate, it will be weakly positive birefringent under polarized light, blue when parallel to light. Here you have yellow when parallel to light, here will be blue when parallel to light. It is very confusing, you should remember it. It is seen in pseudogout or CPPD, calcium pyrophosphate deposition disease. Calcium apatite, it is asked that which of the following crystal is not identified using polarized light microscope. It is calcium apatite. It is not identified. It is seen in area of tissue damage, hypercalcemia or hyperparathyroid states. And calcium oxalate, it is seen in chronic renal failure. It can be identified using polarized light microscopy, and it is bipyramidal in shape. The calcium apatite was needle shaped, just like monosodium urate. Now come to calcium pyrophosphate deposition disease. It was previously called as pseudogout. Calcium pyrophosphate crystal within the joint space. Patient will be more than 50 and both sexes affected equally. and it is usually idiopathic, sometimes may be associated with hemochromatosis, hyperparathyroidism and joint trauma. The mnemonic here is BP, blue when parallel, positive birefringence, calcium pyrophosphate and pseudogout. And there will be pain and inflammation with acute inflammation and or chronic degeneration, which is called pseudo osteoarthritis. Here the most commonly affected joint is the knee. In case of gout, it was first MTP. On X-ray, here we will get chondrocalcinosis, and treatment here almost same like gout, but here we use NSAID colchicine at acute. Also prophylaxis we use colchicine. So after this, you will be able to do the previous question from this topic and also the marrow Q bank of the same topic. Next video we will discuss another topic from rheumatology. See you in next video.